really appreciate everyone joining us today for August's edition of Health Bites with Region 3. And we are so pleased to welcome this month's speaker, Barbara Alvarez. Barbara is the author of the Library's Guide to Sexual and Reproductive Health Information with ALA Editions. She is a 2022 Library Journal Mover and Shaker. Barbara has a PhD in Information Science from the University of Wisconsin-Madison. In today's Health Bites, our speaker will give a presentation on collection development and reference strategies for sexual and reproductive health information. Thank you so much, Barbara, for being our guest speaker this morning, and I will turn everything over to you.
Hello, everybody. Thank you so much for the warm introduction, Margie and Brandon. It is wonderful to be here, and I'm so excited to meet with all of our attendees. So let me go ahead and share my screen, and we'll get the ball rolling here. Okay, so welcome to Collection Development and Reference Strategies for Sexual and Reproductive Health Information. We have quite a bit that we're going over the next 45 minutes, so I'm just going to get started right away. Let me just first give you a little overview about what you can expect during our time together. As I said, we're going through a lot. So a little introduction about who I am. I'll keep that super brief. And then I want to make sure that we're on the same page about what is sexual and reproductive health information before we get into details about collection development, reference strategies, and how to build inclusive library environments. Then we'll do some time to wrap up, and that's where I'll answer any questions that come up. So if you have questions, feel free to put them in, but I'm not going to get to them until the end. Okay, so let's just take a little bit of a time to get to know each other and who's all in this space together. As I said, I'm Barbara Alvarez, and I'm the author of the Library's Guide to Sexual and Reproductive Health Information. I actually have it right here with me, if you can see it. This is published with ALA Editions, and then I just graduated in May with my PhD from the University of Wisconsin-Madison in Information Science, and I focus specifically on this very topic. And then I'm also a 2022 Librarian Mover and Shaker. You can learn more about me at my website. But let's hear a little bit about you. I'd like to know a little bit about where you work. So if you work at a public library, put the number 1 in the chat. I think we can all see it. If you work in an academic library, put the number 2. And if you work in another type of library, put the number 3. Let's just kind of get a temperature of where we're at here. Okay, thank you so much. All right, let's see here. Seeing a good mixed bag. Excellent. Okay, public library, academic, medical. Awesome. Okay, great. So wherever you are, oh, good luck on the job hunting. Wherever you are in the in library world, whether it's public, academic, school, medical, I feel confident that this webinar is going to give you a couple tips and tricks that you can add to your toolkit for collection development, reference, and inclusive environments. Now, I'd also like to know, what is your experience with sexual and reproductive health information in your library space? So if you are a total beginner on this topic, that's awesome. Put a 1. If you've done a little bit, you've dabbled a little, put a 2. Or if you're like, Barbara, I've been doing this for years. I got this. Put a number 3. 2.5. I love 2.5. Okay, great. I'm seeing a good amount of 1s too, which is awesome. Love the total beginners. And then some people who've done a little bit, like maybe you've dipped your toes into this, but you're looking for ways to expand. Awesome. And then a couple 3s, which is wonderful. And I hope that there are some things here that are going to continue to add to what you've already been doing. Okay, wonderful. So this is helpful for me, and I think for all of us, just to kind of gauge where we're at right now. Let's just be really clear before we get into any details. What are we talking about when we're saying sexual and reproductive health information. Because when we say those things, and unfortunately, those terms have become really politicized and they've always been stigmatized, but certainly been politicized. And so maybe we think of certain topics like, oh, you're talking just about sex, or you're just talking about abortion or something like that. But really, we are talking about a more comprehensive concept. So let's dig into that. There are a couple definitions that I want to share. I'm not going to read this whole thing. I'm just sharing it with you as an example of different definitions that are out there about sexual and reproductive health information. This one is specifically from the United Nations Population Fund, and it talks about that good sexual and reproductive health is a state of physical, mental, and social well-being in all matters related to the reproductive system. To maintain one's sexual and reproductive health, people need to have access to accurate information. I wish I could bold that. And the safe, effective, affordable, and acceptable contraception method of their choice. So this is about safety, complete wholeness, and also it incorporates accurate information. Now, the next definition that I want to share, I took this screen grab from the Guttmacher Institute, which is a reproductive health research institute that's been around for almost 60 years. And they have this link between sexual and reproductive health and sexual and reproductive rights. So in order to achieve sexual and reproductive health, they say that we need to have sexual and reproductive rights, which are really based on human rights. So this is about bodily integrity, privacy, self-determination, safety, whether or not to have children. And I think we'll all appreciate the very last bullet point, access over their lifetimes. I wish I could highlight that, over their lifetime. So that includes all ages throughout our entire lifespan, to information, resources, services, and support to achieve all of this. So if I could break it down into my own definition for the purposes of our time together, this is what I would say. Sexual and reproductive health means people have bodily autonomy, are empowered to make choices that are best for themselves, and are equipped with credible information, resources, and tools to make those choices. So if we use this kind of as our guiding principle for the work that we do in libraries, I think that'll help us better understand sexual and reproductive health information, that we are talking about access to credible information, resources, and tools so that people can have bodily autonomy and make choices that are best for them. This is not, of course, as we all know, this is not saying that we are medical professionals, because we absolutely are not. We're information professionals. We aren't giving advice. We're not telling people what to do. We're not giving guidance. We're not interpreting things for people, but we are providing them with what we do best, which is credible information, resources, and tools. And that can support people to make these choices. Just like anything else in our collections, if we had, a legal section or financial section, it's to empower people to make the best choices for themselves. We're not giving them legal advice. We're not giving them financial advice, but they can gather the information and make their choices themselves. So it's the same sort of concept. Okay, so now that we've laid the groundwork for who we are in the space, the work that we're doing, as well as what we're talking about with sexual and reproductive health, let's talk a little bit about collection development. Now, I want to be clear before I get started in this section. Collection development can vary a lot from library to library. As you saw in the chat, we have people from all different types of libraries, all different types of experience, and that means, first of all, I can't know what state you're in, what county you're in, what your budget looks like, what your staff looks like, what your shelving system is like. We all have that variety. So these collection development tips are certainly not going to be curated to every single one of us in this webinar. That would be impossible for me to do, but they are providing overarching guiding principles that you can incorporate. And it includes both physical and digital resources. But before we move on to talking about those tips, I do want to provide this note about providing certain sexual and reproductive health information, namely related to like abortion and LGBTQIA plus information and resources. This is something that I feel necessary to share because I don't have to tell you this, I'm sure you all know, but legislation related to sexual and reproductive health is very much constantly shifting, constantly changing. It varies state to state to state to state related to, as I said, specifically abortion and LGBTQIA plus healthcare. So it varies state to state what the laws are. And then on top of that, we also have a lot of book challenges, and there is legislation related to that too. So I just want to remind all of you, I'm not a legal expert here. I'm an information professional, and depending on where you live in the country, you might have a different experience than somebody else in a different part of the country. I just am bringing this to your attention because I think knowledge is power, and the more information that you have about the current landscape, you can operate in the best position possible as an information professional. For abortion, there are some states that have aiding and abetting laws that some legal experts say could include people that provide information or resources or things like that. There are, as many of you are well aware, state laws related to book bans and that threaten library administrators over information that they deem to be harmful or explicit, which of course is purposely vague. So, we don't always know what they're talking about when they say that. My general guidance here as a presenter, because I want you to be the most prepared and most equipped, is when in doubt, consult with a legal expert in your area who can give you guidance about what you can, how you can present information. And then, as we all know, as information professionals, that we never give out medical advice or we don't interpret health information for people, just like we don't do that with legal or financial or anything like that. And also, I recommend checking out the American Library Association's Office of Intellectual Freedom for additional resources and support about intellectual freedom purposes, including sexual and reproductive health information. So I just wanted to get that out of the way so that we're all on the same page, and also so that you feel empowered to make the best choices that you possibly can and feel confident in those choices. Okay, let's do a quick little poll. What collection development have you done for sexual and reproductive health information? Put a 1 if it's none, 2 if it's minimal, 3 if you're like, I've done a ton here. Okay, couple 3s, but it looks like we're mostly none and minimal. Okay, awesome. Great. So the first thing that I want to talk about before we get into those tips is what is bias, because this comes up all the time for all human beings. This is not specific to library professionals. This is a human issue about our biases. And certainly, though, it could come up in the collection development process, and it could certainly come up related to sexual and reproductive health information. I actually did a national survey 2 years ago where I collected data from 179 library professionals throughout the country about sexual and reproductive health information in their collections. And some people said that they just genuinely had never thought to add this to the collection. I took solace in the fact some people said, oh, this survey gave me ideas on what to add to our collection that I'd never thought of before. So there could be like, I just have literally never thought of adding that before. Or there could be, well, I don't know if we should add that. Is that appropriate? Like, maybe you grew up in a family where you didn't talk about sexual and reproductive health. So that's kind of spilled over into your adulthood and your profession where you're like, oh, is that something that we should be adding to the collection? So there's all these different biases, certainly stuff that we hear in the media, the news, our own personal feelings about things. All of that can play into what we do add to our collection and what we don't add to our collection, whether we're aware of it or not. Now, bias can be explicit, like we can say, I'm not adding that to the collection, or it could be implicit, like, oh, I never thought of that. I didn't think it was important. And it could also be baked into policies, practices, and structures. So when we are talking about sexual and reproductive health, specifically in the collection, I want you to take a look at these topics because this is what we're really talking about. And think to yourself, you don't have to add this to the chat, just think it to yourself. If you happen to have any biases that like naturally come up on any of these topics about like, oh, would we add that to the collection, or is that appropriate, or anything like that? Sexually transmitted infections, contraception, pregnancy, fertility, infertility, miscarriages, sterilization, abortion, menstrual health, sexuality, LGBTQIA plus care, sexual violence. So just think to yourself, are there any of these topics that you're like, I never, like implicitly, I never thought to add that, or, well, I don't know. I have found that a lot of libraries are really comfortable carrying books about like pregnancy, or sexuality or something like that. But when it comes to like sexually transmitted infections or sterilization, abortion, things like that, there's more resistance. So it's like our libraries. So think to yourself with your library, you carrying topics on this subject area that are more popularly available. So just take a moment and think about that. And again, I'm not asking you to share this with the group, but when we are doing collection development, these are some, when we're talking about sexual and reproductive health, these are some questions that we should be asking ourselves when we're adding things to the collection. What do you feel most comfortable collecting? Like related to this topic on that previous list, are you like, yeah, I'd have no issue collecting that. It's not a problem. And where do you feel the most resistance? Are there any specific topics on the previous list that you feel the most resistance in adding? And now thinking about, and you could also think to yourself, like, what do we as an institution feel most comfortable collecting? And what do we as an institution feel the most resistance in adding? There's no right or wrong answers here. This is not to make anybody feel bad about themselves or judge their organization. This is simply just to understand what are the potential gaps in our collection. And is it just because we're overlooking things? So think to yourself, maybe jot a couple notes down. What do you feel most comfortable collecting? Where's the resistance? And is that translating to any gaps that you're seeing in the collection? This might be something, if you haven't looked at your collection in a while, maybe after this webinar, you could go over there and just take a scan and you can see, like, is this being reflected in our collection or is it not? So some basic steps for collection development related to sexual and reproductive health information. The first thing is, after you've assessed any biases that you may have, is do a scan of, just like you would for any other collection in your library, what is old and what is needed. Now, in my experience, when I personally have done sexual and reproductive health collection development, as well as I've also seen other libraries and talked to other librarians about their collections, the sexual reproductive health information is sometimes very outdated, very textbooky, or it's like only academic, like their opinion pieces, like opposing viewpoints or something like that. There isn't necessarily guides, manuals, and information. I remember I worked at a library once where like our sexual reproductive health information was really limited to like pregnancy and like, I think we had like the Joy of Sex book or something like that. We didn't have, we didn't have all these other topics. So what is old and what is needed based on that previous list that we looked at? miscarriages, sterilization, sexually transmitted infections, sexual violence, things like that, like LGBTQIA plus information. So what is needed and what is old? And when I say old, now old is like, well, what do you mean by old? On certain topics, like let's say abortion, in 2022, the US Supreme Court overturned Roe v. Wade, which made abortion a state's issue. So technically, if your library had a book on abortion from 2021, that could be considered old at this point because it might be outdated information depending on where you live and depending on what's in the material. Other material might like literally be old in the sense that this is like from the 80s, from the 90s, from the early 2000s. And so old is kind of relative depending on the topic, but consider what is outdated and then what are those gaps that you're seeing? Where do you not have the information? When you're trying to figure out where the gaps are, consider the legislation also in not only our country, but also in your state. For example, if you go to the Guttmacher Institute's website, there is a way that you can find out if your state requires sex ed to be medically accurate. And I think, don't quote me on this, but I think it's only like 7 states require sex ed in schools to be medically accurate. They have a bunch of other details in Guttmacher Institute about sex ed in schools. So I would recommend checking that out and then seeing perhaps if you could see like on a county level, what maybe the county board has decided about sex ed in your school, if you can even see what the curriculum is like, and then you can build the collection based on that. Same as I said with abortion. Abortion is now a state's issue. It's no longer constitutionally protected. That's been going on for about 2 years. Laws are constantly changing related to abortion in certain states across the country, tied up in the courts. There can be a lot of confusion there. So considering both physical and digital resources that can cut through that confusion. And then same with LGBTQIA plus information. There are a lot of court cases across the country about these topics, specifically related to youth. And so finding out what information is, what the legislation is like and what gaps there may be. The other thing that you want to consider with collection development is where this material is actually placed in your collection. I've seen libraries where like religious material about sexuality, about abortion, contraception, sexual violence, things like that, is placed in like the medical section when it's really religious. Like if you were to do the aboutness of the book, it's really a religious text. It isn't a scientific or medical text. So going through that and making sure that things are placed in their correct sections is also important. The other thing is sometimes historically LGBTQIA plus information has been pathologized and put into sections related to like mental health or mental illness or something like that, when really it's medical information. So seeing if there's any shifts that you can add to that collection. Then the other piece, the fourth piece with the collection development is thinking about your digital resources, because truthfully, there are only so many physical resources that we can add, first of all, in terms of our budget and in terms of what's readily available, perhaps in terms of our shelf size, things like that. So digital resources are a great way to complement our physical collection. Where might you find that the digital resources can complement your physical collection? And also, how can you activate the digital resources? Because most people are not going to go to your library website and like, oh, I'm going to go look for information about contraception on their library website. They're not going to know it's there. So how can you activate it within the physical collection? We're going to talk about a couple of those tips. Okay. Some other concepts when you are developing your collection, whether you are completely refocusing it, starting from the ground up, or doing a big weeding project, a couple of things to think about that you may not have thought about before. When it comes to sexual and reproductive health information, rethink circulation statistics. Historically, when we do weeding for a collection, you might say, well, if this hasn't circulated in the last 2 years, or if it's circulated less than 5 times in 5 years, or whatever your standards are. With sexual and reproductive health information, I encourage you to think a little bit differently about that. First of all, sexual reproductive health information is probably not going to be like a New York Times bestseller, like coming in to get whatever is on the New York Times bestseller. Like it's just not going to circulate as much just because of the certain topic that it is. So there's that to consider, but also we have to think about stigma related to checking out sexual and reproductive health information. Some people might be too embarrassed to bring this even to the checkout counter at the library. If you don't have a self-checkout station, some people might not feel safe bringing this home. Some people might not be aware that librarians don't share that it's confidential and private. They're in a small library and they're like, I don't want the librarian to know I'm checking this out. Or I don't want my partner or my parents to see that I'm checking this out. So some people might look at this specifically in the library. They're not actually taking it out of the library, but they're using it in the library. I had that experience when I worked at a specific library and somebody came in specifically to look at information about sexually transmitted infections. They didn't check out the material. They went through the books in the library. So rethink what circulation looks like for those things. The other one is to consider quality over quantity. Depending on your budget, you might be like, we only have so many dollars, and that's okay. Like you don't have to have a good sexual and reproductive health information collection does not mean that you need to have 100 books. But having good quality books and making sure that they are in readable formats, that they aren't too textbooky or that they aren't too academic-y. Like I said, those opposing viewpoint books on certain topics. So like that they are actually health focused. I encourage you to set up Google News alerts on some of these topics, especially if they are specifically relevant to the state that you live in, so that you know when you can be updating physical resources as well as digital resources. You might want to consider how your library can utilize interlibrary loan when you're adding materials. Like, okay, if you're on a tight budget, what other libraries in your consortium or your system have these? Could you set up a committee where you kind of divvy up who gets certain topics or how it can be spread out across the consortium so you can utilize interlibrary loan in that way? Are there partnerships, whether it's like a community partnership or another library partnership you could utilize? And then also grants. There are grant opportunities that are coming out right now. I see them all the time. And perhaps this is an opportunity for you to apply for a grant on this topic, especially if your library doesn't have a lot of wiggle room with the budget. Now, if budgeting is really an issue in terms of adding to the collection, I really encourage you to think about how you can use digital guides. I have seen many libraries create LibGuides and resource guides, both public and academic, about sexual and reproductive health. I saw several libraries do this after Roe v. Wade was overturned 2 years ago, where they provided a list of books as well as news and resources. And I'm going to share a few of those with you. Thank you for sharing, Laura. The other thing I want to say that I don't have on the slide, but when we're talking about sexual reproductive health collection development, we might be thinking of like factual information, which is true, and that's important, but also think about stories about sexuality, LGBTQIA plus information, abortion, miscarriages, things like that are fiction that you can add to your collection as well. So or not even fiction, but like memoirs, things like that. So a little bit of a balance there. So that's something to consider where you might be having gaps in your memoirs or your fiction section. Okay, so a couple books that I want to share here. As I said, we are in a variety of different libraries with budgets, different states, all of that. So these are consideration tips. One for teens is through Rosen Publishing, and it's called the Sexual Health Awareness Series. Now, the American Sexual Health Association also have books that you can order directly from their website, and they also have free downloads. The Boston Women's Health Book Collective has Our Bodies, Ourselves, which has really been a staple for about 50 years. I believe it's available both online and physical. And LGBTQIA plus material is something that should not be neglected when we're developing our sexual reproductive health collections. One example that I have here, just one, I know there's many others, is the Pride Guide by Joe Langford. Reproductive justice books are helpful, not just about reproductive health, but reproductive justice, which is really a human rights focus. And it goes through quite a bit of reproductive justice or lack thereof in the United States from a historical lens. If for a great introduction to that, which would be an awesome book club idea, I think, is Reproductive Justice, an Introduction, and then also Killing the Black Body. If you go to the Mayo Clinic Guide, if you go to Mayo Clinic Guide's website, they have categories for pregnancy, and then they also have a category that they label as women's health. So you can find materials there. And then Your Sexual Health by Dr. Kate White is a relatively new book, which is pretty comprehensive. And then something else that I want to add in here, when we're talking about sexual reproductive health, sometimes our own biases, going back to those biases, we think of like historically or traditionally women's sexual health and fertility, but also in addition to incorporating LGBTQIA plus sexual health and fertility, men's sexual health and fertility, which is sometimes neglected in these conversations. Now, I have some links that they're going to share in the chat. You can look at these later for more information, but I wrote 2 articles for continued education on these topics. I'm not going to go through these articles now together, but I'm just sharing them with you so you can read them later. One I wrote for Library Journal. It's called Reproductive Health Information in Your Library's Collection, and it has a list of books there that you can utilize. And then another one I wrote for Booklist Online, and it's a reproductive justice approach to readers advisory. So I encourage you to check out those articles in your own time. They might be really helpful. Okay. Some online resources when we're talking about activating physical collections as well as developing digital guides. Sticking to fact-based websites and resources. ASHA, the American Sexual Health Association, has great resources for all ages. The Centers for Disease Control and Prevention. The Guttmacher Institute is excellent, especially for legislation on abortion, sex ed, all types of sexual reproductive health. They even have a legislation tracker. Highly recommend that. The National Institute for Reproductive Health has some helpful resource guides that can be really useful as well for people. You might be able to print them out or direct them to people. Kaiser Family Foundation and Guttmacher Institute, those are probably 2 of my favorite ones that I like to go to because they're really fact-based, evidence-based, study-based. And Kaiser Family Foundation has a ton of resources there as well. Then there is Sex Ed Library, which is it's a really colorful website, and it's to make sex ed available and accessible for people of all ages. The World Association for Transgender Health website, and then also something else I want you to consider is, first of all, checking out your local county or your state resources. I have CDC on here, but see like the health department locally or on a state level. For example, I know some counties have said like, we have sexually transmitted infections are on the rise in our county, like syphilis is on the rise or something like that. I think that was actually going on in the last year in a couple of counties in the state that I live in, actually. I had seen a news report about that. And so you can get information about what's going on related to sexual reproductive health issues from like state level as well as county level. So check that out. But another thing is look at your public universities because they also might have data and research that's being done on a state level. This is an example I will give you. I'm in Wisconsin. There's something called UW Core, which is the Collaborative for Reproductive Equity. They're located through the University of Wisconsin-Madison, and they have a ton of research specifically about sexual and reproductive health in Wisconsin. So see if I know, for example, Texas has one. It's called TextPep, I believe. TXPEP, I think it is. I know Ohio has one. And I'm certain that other states have them as well. So look at your public universities and see what research is being done there. In terms of databases and journals, you might already have subscriptions to these databases, but I'm just going to share them anyways. So Gender Watch, which is available through ProQuest, LGBTQ plus source, which is available through EBSCO, PubMed, and then Centers for Disease Control and Prevention, which is a freely available database. And then these journals, which you can often find through databases that you can refer people to for evidence-based research. So Archives of Sexual Behavior, BMJ Sexual and Reproductive Health, Contraception Journal, International Journal of Transgender Health, and Perspectives on Sexual and Reproductive Health. Okay, now let's get into a couple of reference strategies so that we can support health information. The main thing is that, yes, Ellen, I believe that is. And again, yeah, it might not be available in some libraries, depending on what your firewalls are. But I believe that is the right link. Okay, so patrons should feel comfortable going to the library and asking for help or finding resources on their own. So people should feel comfortable asking librarians for information or finding resources on their own. 3 issues, though, that can impede that is library anxiety. People already are nervous coming to the library in general and asking, where are the cookbooks, much less, where are your books on contraception? There is stigma related to sexual and reproductive health. And then there is health anxiety. So we have these 3 compounding issues health literacy. And health literacy is just like literacy in general, but like related to health. People might say, oh yeah, I understand what you're talking about when they're talking to their doctor, when they get a prescription from the pharmacist, but they don't really understand what they're talking about. They just don't feel comfortable saying that. So we have to keep in mind all of these 3 compounding issues that can impede on reference services. So you don't need to share this in the chat, but again, it's a little piece of reflection. What are your current reference practices? First of all, is your reference desk easily identifiable? Is it regularly staffed? And are the staff who are working there, are they welcoming? Just be honest with yourself, write some notes and yeah, so maybe the website isn't available for some people. So think about what reference practices are like in your library. Okay, couple of steps that we can take to improve reference related to sexual and reproductive health information is taking the initiative to let people know that sexual and reproductive health information is welcome in our library and you are welcome to ask those questions. We're going to talk about that shortly. Using active listening skills, just like we would with any type of reference interaction, not making judgments about people or assumptions, really considering people's privacy when they're asking us questions, and then remembering your role as an information professional, not as a health expert or interpreting health information. So let's dig into these just a little bit. How can we let people know that we are a welcome space for sexual and reproductive health information? As I was talking about in the collection development area, activating your digital tools. So you can use shelf talkers in your collection development that link people to the resources, to digital tools, to journals, to websites, to articles, and they can link out so people are aware that there are more resources available. You could also have a tough topic signage where you specifically include the call numbers for this so that people can look them up on their own. In terms of privacy, consider if your library has self-checkout, how you can promote it a little bit more, how you can get different reference transactions through email or chat or text for people that don't necessarily feel comfortable calling or coming to the desk. Reminding patrons, especially like when you're talking about sexual and reproductive health, this is a great time to remind people that we don't track their searches, we don't track their computer usage, We don't track their checkout, their circulation. Staying in our lane about never interpreting information. And then also moving to a more private location is necessary when people are talking to us about any type of medical information, perhaps moving them over away from the reference area if it's super bustling over there. And then, as I mentioned with health literacy, offering a variety of formats. Sometimes those textbook heavy sexual reproductive health information books are just overwhelming. So how can we develop collections that are in a variety of reading levels and aren't only in books, but are also online? Some additional links on reference tools that I recommend that you dig into after this webinar. The ALA has a privacy audit website, so you can check your library's reference practices, computer usage practices, circulation practices to see that how your library is doing, kind of like a self-assessment related to privacy. And then also RUSA updated their guidelines for reference interactions. And I highly recommend taking a look at they updated like a year or two ago. I highly recommend taking a look at it, specifically in relation to questions related to diversity, equity, and inclusion, as I think sexual reproductive health is along that, as well as active listening. However, as we've said throughout this presentation, you're not a medical expert, you're an information professional. So you might think to yourself, I don't know all of this information. I don't know the answers to this. That's okay. Being able to direct people to the information is your role. And in developing the collections, both physical and digital, you are understanding a little bit more about these topics, and then you can therefore direct people accordingly. So the last piece, because time is flying in this webinar, and I want to make sure that we have time for Q&A, is we're going to be talking about creating inclusive library environments, health-focused environments. So this is going to build upon what we've been talking about related to collection development, related to reference strategies, and so we can create more of a holistic environment related to sexual and reproductive health. As we were just talking about, with the collection and with reference, it's really important that we let people know that the library has sexual and reproductive health information, because more often than not, people are not going to come to the library thinking that we have this information, unless maybe you're a medical library, they might think that. But for the most part, people might not think that the library has this information available or that they are allowed to access this information. So some basic steps that we're going to talk about in this section: how we can create an inclusive environment, content creation, program planning, library collections, and continuing education. Oh, and Ellen, I just want to add in there, there's a really great training about adolescent sexual health information. I think it's called through Advocates for Youth, I want to say. I think that's available through there, or you might be able to link to it from, I included on here, the National Institute for Reproductive Health, NIRH. I think you can access it through there too. They have something on training for adolescent health, sexual health information. Okay, so content creation, resource guides, which it seems like we're talking quite a bit in the chat, tutorials, and QR codes. So there's only so much that we can collect related to physical material. The resource guides we can add to our website, we can print them out, we can activate them through QR codes. With tutorials, I would recommend tutorials, not necessarily on sexual and reproductive health topics, unless you partner with like a local organization or something like that. But perhaps how can people search for this type of information through the databases, in journals, on these websites, in the catalog. So having tutorials on how to use your catalog, or how to check out material, or privacy facts at the library, or how to access our resource guide online, or how to utilize this database. Those can be really empowering, and you can incorporate those tutorials with QR codes within the physical collection as well. For programs, this is a great way to activate your collection as well as your reference strategies. So again, letting people know that you have sexual and reproductive health information available at your library in the collection, as well as that people can ask this at the reference desk. You can develop programs for this. You can work with local organizations on this, whether it's like Planned Parenthood, a family health center, a hospital, maybe there's a local expert, a university, a school system. Awareness months are a great time to do that. I have a couple listed in the next slide, but I do want to add in here a caveat related to programs. Take a look at your library policies. This also goes for collection development and reference too. Make sure that your library policies are supportive of providing sexual and reproductive health collections, reference services, and programs. So before you dig into that, I think it's a good opportunity to go through those policies. And again, they might vary a little bit on depending on where you're located. So a couple of you might be like, well, what tutorials could I do? Or what programs could I do? These are just a couple that come to mind. And feel free to add any others to the chat if you have some. But, and I've done some of these programs on like consent and safety, menstrual health, pregnancy and safe sex, contraception, miscarriages. There can be a lot of stigma related to miscarriages. I believe 1 in 4 people who get pregnant, or 1 in 5 people who get pregnant, have a miscarriage, but people don't. So it's not uncommon, but people often don't talk about it, or it is stigmatized. So this is an opportunity to bring information to the public and help people feel supported in the community. National Breast Cancer Awareness Month. Sex talk. I once hosted a program on like how to talk to your teens about sex. And we hosted that with a sexual health organization. I once also had a nurse come in who specialized in gynecology, and they talked about gynecological cancers. And then infertility awareness. So all of these you can incorporate not only in your collection, but also in any resource guides that you create, which can therefore activate your collection, as well as in your programs, and letting people know that these are topics that people are welcome to ask at the library. Now, we can't do everything, and nor should we do everything. And also, we aren't the experts on everything either. So I highly encourage you to develop collaborations when you are doing sexual and reproductive health, collection development, references, and in creating inclusive spaces. Whether this is just at your library, maybe you have like a committee of staff at your library, informally or formally, whatever it is, where you actually brainstorm together so you're not the sole person working on this. Or if you can work with other libraries in the area and come up with ways that you can support each other as you develop your collections and your programs, or through your library association, like your state library association, or if you have like a more local consortium, that you can start bringing these topics, maybe sharing ideas with each other on how you're developing collections, how you're cataloging this material, the programs that you're using, the presenters that you're hiring, the partnerships that you're building in your community, maybe a local toolkit that you can all build together. So that way you don't feel isolated in this. I think that's a really important thing. Sexual reproductive health information can be stigmatizing, not just for patrons, but also for librarians too. And if you can have the support from other people, just like we have in this room, that can make the process smoother. And also it's a great way to communicate back to the library community, the board, your directors, your management team, and in general, that there is support for this information and that it's necessary information too. You aren't this sole person trying to make this happen. And part of that includes a little bit of continuing education on our on our part. For example, I'm working with a library system right now. They are working with local organizations for training opportunities for their staff on sexual and reproductive health information. So that's something that you could look into. There's a ton of tutorials online. The websites that I listed, often all of them in the collection development section that I had, they have resource guides, tutorials, and ways that you can continuing ed yourself. Because the more that you know about sexual and reproductive health information, the better your collection is going to be, both physical and digital, and the more informed you'll be with reference questions. Of course, the network of the National Library of Medicine has great resources and recordings that I highly recommend that you dig into. The Centers for Disease Control and Prevention also does. And then the Public Library Association has great tools on like reference strategies, privacy, confidentiality, things like that. So I highly recommend that you continue your education as you are working through sexual and reproductive health collection development program planning. So I know I'm getting a couple questions that come in, and it looks like we have a few minutes to answer them. I do want to end with this and saying, this is about progress, not perfection. Just like anything else that we do in library land, we're working as best we can. And the more that we learn, the more improved our collections will be, our programs will be, our reference strategies. So this isn't something that's going to be done in a day. This is going to take some time to build up, and that it's not about being perfect, having everything right, but it's about working towards that information access for everybody. And I'm going to answer some questions now, and then if you'd like to stay in touch, that's how you can get in touch with me. But thank you so much for your participation. Okay. Have you ever done a period party and also I just want to say, I know this was a ton of information that we jammed in a short amount of time. This could easily be like, a multi-month presentation. So I just want to thank you for bearing with me for your the chat that you've been giving, and for just being here. I hope that this is the catalyst for you for doing more of this work. And please do let me know if I can support you in any way. Okay, let me get to the chat. So have you ever done a period party for tweens and teens? How would you go about convincing admin to allow this? If anybody has done a period party, feel free to add that to the chat if you know of any resources. I have not done a period party myself. I have heard of them. I actually know of a couple libraries that are planning them right now. And I think, how would you go about convincing admin to do this? Looking up information about menstrual equity and menstrual health, the stigma and period poverty. So I think if you can go to that, and I wish, I met somebody at ALA that does period. Okay. Sorry. I wish I had it right in front of me. Of course I don't. But there is actually, if you Google like period parties, period poverty, there are organizations, perhaps even in your state, that have resources related to it. And so I think if you can lean on the statistics about period poverty, menstrual health, menstrual pain, and it's about destigmatizing. You might even be able to find some information specifically in your state or even on a county level if you contact your local health department related to it. You could also see if the school system does anything related to period parties or menstrual health and see if there's a way to partner there. So I would lean heavily, if you're trying to convince the board, I would lean heavily on the statistics about menstrual health, and then also see if you can bring in partnership and buy-in from an organization in your community. So it's not just about you. Yes, and thank you. That's it, Molly. Alliance for Period Supplies. That's it. Thank you. And also Bailey put in a great link there about the period game, which she just told me about recently. So, okay. Do you have any recommendations for grants for public libraries to do this work? I don't have any specific recommendations for grants, But I've seen a couple IMLS grants come up the pipeline. I've seen it on my LinkedIn. So I would just recommend going through IMLS and seeing what might be available. I also do know there's like a digital equity grant that's come out recently. There's a way that you can tie in digital equity with this. And then also don't discount like any grant opportunities on a local level with any organizations that you might be able to work with. This isn't related to sexual reproductive health, but I once worked at a library where we got a grant related to so that we could start a podcast at our library. So you never know what local organizations might be wanting to support your library in a new initiative, and sexual reproductive health might be one that they're supportive of. Do you know of LibGuides that focus on teen sexual reproductive health resources? So, Ellen, off the top of my head, not like a specific library LibGuide, but as I said, I think if you go to the National Institute for Research Health, I believe on there they have a tutorials page, and then there's a curated tutorials, and I believe they have one for adolescent sexual health. And if it's not there, I believe that it's on the Alliance for Youth or something that they have it there. So I think that would be good. Yes, Megan, talk to your local health department for grants and partnering and things like that. Oh, awesome. And then there are health literacy grants through NNLM. Awesome. Okay.
Barbara, I'm just going to jump in here real quick. We want Barbara to have plenty of time to answer your questions, but we know we're getting to the top of the hour. So we're going to go ahead and drop the survey link in the chat. If you could please fill that out, we would really appreciate it. And we're going to go ahead and answer some more questions. Go ahead.
So I'm going to get to these questions, and I totally understand if you need to leave. Thank you again for being here. Let's see. I work in a large public library system. There isn't much pushback about actually buying these materials, but a lot of pushback about advertising, digital guides, and other things that go beyond baseline or are more public. Yep, I get it. Do you have any recommendations for advocating for sexual and reproductive health to management who don't recognize the importance or urgency? Okay. At the risk of self-promotion, and I truly don't mean to be like promoting myself here. In my book, The Library's Guide to Sexual and Reproductive Health Information, I do have a whole chapter in there about why sexual and reproductive health information is a library service. I'm not saying go out and buy this book. I'm saying if you can access it through a library system, like get it through interlibrary loan, you might find it helpful. But let me just give you like a quick rundown about what's in the chapter. So if you can't access the book, just jot these ideas down and Google them on your own. So I talk about the Library Bill of Rights in here and what it explicitly states about resisting efforts to exclude materials on sexuality, sexual identity. I talk about the First Amendment and intellectual freedom, ALA's freedom to read statement. Then I also talk about how sexual and reproductive health is a human right. You can look at the United Declarations of Human Rights, UDHR. World Health Organization agrees, and it's actually one of their sustainable development goals. The Guttmacher Institute has information about this. So basically it's connecting this not only to information access, but also human rights. So I think if there's a way that you can explain that to how libraries are about empowering individuals and having healthier communities, and information access is part of this. Sexual and reproductive health information is health information. It has been politicized though, but it is health information. So truthfully, if we take away the stigma around it, how is this any different than providing information about like dental care or something like that? Like you wouldn't feel awkward about that. This is because of the topic, but it is healthcare. That's why there are doctors on these topics. That's why there are people go into medicine for this. These are health issues. So if you can do that. Okay. Okay. What is the name of the organization that provides teen? Oh, I think I shared that already with Ellen. Okay. I work at my state library and only work with ebooks and e-audiobooks. As a state employee, I can't be seen as lobbying or advocating one way or the other. How can I show this is needed in our collections? Okay. So I totally understand about not being seen as lobbying or advocating or anything and I'm not saying that anybody should be lobbying or advocating for this. I'm not saying we need to, that's what this position is. This is simply sexual reproductive health is health information. It is often neglected in our collections, and yet it impacts every single person on this planet, no matter who you are. So this isn't really about like, well, I'm advocating, I understand what you mean, but like, this is about recognizing that sexual reproductive health is a fundamental comprehensive health issue and that it's often neglected. And the only reason that it's neglected is related to stigma and politicalization. So in terms of showing that it's needed in our collection, I think like showing where the gaps are, perhaps comparing how health information in other parts of your collection compare to the lack thereof related to sexual and reproductive health information. Maybe if you can get any information from like the state or county health department about like what the health needs are in your area and how this is relevant. So if you can bring in facts about how this is health information, there's a gap in it and there's a need, whether it's through data you collect locally or from a state level or even from a national level, and then comparing what the collection looks like from a digital aspect compared to other collections, and perhaps even seeing what other libraries are doing and comparing that too. I hope that's helpful. I know it's not an easy solution, and I totally appreciate the situation that you're in. Is there a core collection list for sexual reproductive health across the lifespan? I haven't seen like a core collection list for sexual reproductive health. I've seen quite a bit of different libraries having their own LibGuides, their own resource guides. I haven't seen a core list though. Again, not to like promote myself, but I do have an appendix in my book. If you can access it, like through a library, you might find that helpful. I can read you some of the sections that I had on here, like reproductive and sexual health, reproductive justice, sexuality and LGBTQIA health, sexual pleasure and consent. So I think if I were to say a core list, like go to that topic list that I included on this slide about all the different sexual reproductive health topics and use that as a guide for like what books and materials you can add. I hope that helps you get started. It looks like those are all of the questions. I'm just looking through the chat and seeing if there's anything else there.
Yeah, I think we're in good shape.
I think we're good.
Well, listen, I really want to thank you, Barbara, for joining us today. This has just been so informative. And there was a request for part 2, so we'll have to talk with you about that.
Oh, yeah, I would love to.
Yeah, so we do thank you for sharing your expertise with us. And we do look forward to seeing all of you next month at Health Bites with Region 3.
All right. Thank you so much for having me. And thanks for everybody for coming.
Thanks for watching. This video was produced by the network of the National Library of Medicine. Select the circular channel icon to subscribe to our channel, or select a video thumbnail to watch another video from the channel.